Collagen disease, uterine fibroids, lupus erythematosus, rheumatoid arthritis, bruises, retroperitoneal hematoma. Western medicine believes that uterine fibroids are caused by excessive estrogen levels. However, if the level of estrogen is too high, the subcutaneous fat should be very thick. Uterine fibroids actually have poor blood flow during menstruation. If you find a blood clot in your menstruation, you should use some menstrual medication in time. Take motherwort ointment for 5 days every time you have menstruation. Women should pay attention. Do not eat mango during menstruation. Uterine fibroids will occur. Lupus erythematosus. Western doctors discovered the pathological basis of endovascular inflammation, and later invented chemically synthesized corticosteroids. However, the patient still died of renal failure, severe secondary infections and myocardial infarction caused by hormones. If lupus erythematosus is not diagnosed, the patient may live a few more years, but once the patient is diagnosed, Western medicine gives corticosteroids, anti-inflammatory, and painkillers, triptorigine wilfortii, and chemical drugs, and the patient will not live long. Since endovascular inflammation is found, it only needs to clear away heat and reduce inflammation, but Western medicine does not know how to reduce inflammation. Lupus erythematosus is a common chronic disease, but the misdiagnosis rate is extremely high. The names of diseases misdiagnosed by Western medicine are mostly chronic arthritis, chronic nephritis, and chronic anemia. This is because lupus erythematosus, a typical discoid rash on the face, is rare. Rheumatoid arthritis. What is worthy of recognition is that Western medicine is much more profound than traditional Chinese medicine in the understanding of rheumatoid arthritis. However, the effect in terms of diagnosis and treatment is not satisfactory. Although advanced technologies such as B-ultrasound CT magnetic resonance are widely used in medicine, it does not reduce the misdiagnosis rate. The treatment mainly uses non-hormonal anti-inflammatory drugs, alleviating drugs, and the adrenal corticosteroid prednisone. For rheumatoid arthritis, long-term consumption of hormones can cause osteoporosis and pathological fractures throughout the body. Let rheumatoid patients take triptorigine wilfortii polyglycoside tablets, but triptorigine wilfortii is an acute poison. This toxicity causes women to stop menstruation, which is incurable. Based on rich clinical experience, traditional Chinese medicine has summarized 2 important characteristics. The first is that when the patient wakes up in the morning, the joints of the hands and feet are stiff. The patient feels stiff and painful joints all over the body, especially the fingers and toes are the most uncomfortable. At this time, Western medicine examines the patient's joints and cannot find any problems. The second is that the patient is prone to thinking errors in the evening. The patient can't even remember a very familiar name, a commonly used word. In the evening, the elderly easily get lost. This is the first sign of cerebral arteriosclerosis. At this time, Western medicine examines the fundus arterioles. It is impossible to find the problem. Stiffness in the morning is a term of Chinese medicine, and Western medicine has followed many terms and terms of Chinese medicine. All rheumatoid patients have this kind of performance, which is one of the important diagnostic bases. It is characterized by joint stiffness in the morning or after waking up, inflexible movement, and body stiffness in severe cases. Often accompanied by chills and numbness at the extremities or fingers and toes. It takes less than 1 hour for mild, 1 hour to 6 hours for moderate, and more than 6 hours for severe to relieve and disappear. The second important sign is joint swelling or pain. Clinically, it is divided into spontaneous pain and active pain. Spontaneous pain is pain when the joints are inactive or in a quiet and natural state, sometimes even waking up from sleep, which indicates that the disease develops faster. Movement pain is felt when the joint moves, which indicates that arthritis is relatively mild. Rheumatoid arthritis, the characteristic of the pain is that it is relieved after exercise, and then aggravated after a rest or when the exercise is just started. When the joint pain becomes severe, in the morning, at night, when it rains on a cloudy day, when the weather is cold, especially when you have a cold. Rheumatoid arthritis can neither be heated nor frozen. It is wrong to irradiate infrared physiotherapy lamps. Heating does not promote blood circulation, but promotes the expansion of capillaries. Many diseases cannot be heated, nor can pedicure and massage. After heating, the exudation of blood vessels increases, and the adhesion of joints will increase. How many athletes rush to undergo surgery because they were afraid of affecting their sports performance, which ultimately ruined their lives? Even comminuted fractures do not require surgery, because people have a very strong self-healing ability. Before you have an operation, you need to consult the orthopedics department of Chinese medicine.